This is a special report from Wdhn News.
Good morning, I'm Ilyana Capellan, and right now we are expecting an announcement from Governor Ivey on what measures Alabama will take ahead of the expiration of her safer at home order this Friday. Joining the governor will be State Health Officer Dr. Scott Harris, who has spearheaded the health department's effort to manage the virus. Now, here's Governor Ivey.
Along with Dr. Harris, I'm here to provide an update on our current health order and talk about our plans for going forward. But first, I want to be sure everybody has seen the feature about my colleague, Dr. Harris. He was named a community hero by the Montgomery Advertiser, etc., and that's just a nice award. Let's give him a round of applause for this nice recognition. Our current health order expires Friday, December the 11th. This order was issued in early November and was designed to keep people safe while still at the same time ensure we could celebrate Thanksgiving as well as keep our businesses and retailers safely open during the holiday rush. By now, it's obvious that most Alabamians gathered together in new and creative ways to keep their vulnerable families safe while giving thanks in the midst of a very hard year. Whether it was eating outdoors, as our forefathers did on the first Thanksgiving, or limiting the number of family and friends we were with, Alabamians have been showing incredible resiliency in doing their part. Some even chose to forego the traditional Thanksgiving celebration in order to be safer rather than sorry. And while that may have been a very wise decision, it was still a hard decision. And y'all, none of this is easy. None of it is. As I've previously, I cannot thank the people of Alabama enough for the sacrifices you are making, sacrifices for yourselves and for others. Because of the pandemic has stretched much longer than we ever imagined, we all just downright exhausted by the disruptions to our daily lives. And even though the vaccine's delivery is right around the corner, we shouldn't lull ourselves into complacency by thinking we're out of the woods yet. To the contrary, as Dr. Harris will elaborate, these are some of our darkest days since COVID-19 became a part of our daily conversations, and the rising number of new cases has put a strain on our healthcare system unlike any time in recent memory. We look forward to the days where we can greet one another again and interact in public while easily seeing each other's faces and smiles that aren't hidden behind these blooming masks. However, this is one sacrifice that we all can make in order to keep our friends and loved ones safe and keep the rest of the disruptions to our personal lives at a minimum. Let me remind the people of Alabama as clearly as I can: wear your masks, wash your hands, and sanitize your personal spaces as much as possible. Now, y'all, I'm not trying to be Governor Meemaw, as some on social media have called me. I'm simply trying to urge you to use the common sense the good Lord gave each of us to be smart and considerate of others. For goodness sake, if you're experiencing symptoms, please go get tested and wait until you receive your results before interacting with others. Unless you test negative, please refrain from being around others. If Coach Saban can do this, then so can you. The facts are indisputable. Our cases continue to rise, and we have more Alabamians diagnosed with COVID-19 than ever before. Because of this, we will be extending the current order with no changes for another 6 weeks until January 22nd, 2021. In the last press conference, Dr. Harris and I discussed and acknowledged that you can't have a life without a livelihood. So let me be clear. Since May, my team and I have never seriously discussed another lockdown on our businesses and retailers. Because we've learned to live with the virus and incorporate precautions into our daily lives, and we've been able to loosen the restrictions on gathering sizes and reduce occupancy rate, even as many other states around the country are reversing course. This is largely due to the personal responsibility of the people of Alabama wearing a mask to keep themselves and others safe. In fact, the mask mandate remains the one stopgap in order to keep the balance of our daily lives and maintaining health and safety. We've returned to school, to church, and to work under the conditions of simply wearing a mask. And in many ways, the only limitation on us that is left is the mask. So I ask everyone, as we strive to get back to normal, as the vaccine begins to be rolled out to the most vulnerable populations, that we don't just flip the switch and mentally move on from taking precautions. Like many things in life, just because you can do something doesn't mean you should. So please continue to be considerate of the vulnerable members of your family and those you work with. Please, please continue wearing the mask, even if you're the only one in your surrounding to do so. You may just be the reminder someone needs to pull that mask out of their pocket or purse and put it on. So as we transition from Thanksgiving into the season of Advent and the celebration of Hanukkah, which begins tomorrow, or other reasons which bring families and friends together, please be mindful of others in your activities. As Dr. Harris makes his way to the microphone, I'd like to once again thank the people of Alabama. Thank you for hanging in there and doing the right thing, even when we are all ready to say goodbye and good riddance to COVID-19. Dr. Harris.
Thank you very much, Governor. Thank you very much for your leadership and for what you're doing for our state. Good morning, everyone. I appreciate the chance to join you today. I wanted to spend some time talking about the vaccine rollout, which is imminent for us, and I'll be happy to answer questions on that. Before we do that, I do want to reiterate something the governor said. We really are in a difficult time right now in Alabama. This is a very challenging time, and we're looking at some pretty dark days for the foreseeable future. As you know, even in the country now, there are numbers that are out of control in many parts of our nation. Since February, we've had about 15 million total cases in America, and yet we're now adding about 1 million cases a week in America. So 15 million before now, but now we're adding about 1 million a week. Here in Alabama, we've reached new numbers of hospitalizations. We're up or right at 2,100 people who are inpatients. That's about 500 more than we were seeing back during July when we were having such a difficult time. So it's significantly higher at this point, and we're seeing more than 3,000 new cases a day for the past few days. These are not backlogs or data dumps, but these are actually new cases for us. And finally, we just have to remember we've got almost 4,000 of our family and loved ones and friends who aren't going to be here this holiday season that we've lost so far in our state. If you had a 747 crash every month for the last 10 months, that's about how many people we've lost in the past 10 months in our state. We want to keep that from continuing, and we really want to encourage everybody to keep doing everything they can do to keep themselves and others safe. We do have some cause for optimism with the rollout of the vaccine, and I want to just spend a little bit of time getting into the details of that as much as you all would like. We do expect that Alabama will probably receive a vaccine product sometime early next week. We get lots of questions and lots of social media rumors that there's vaccine here already, but there is not. There's no EUA that's been issued by the FDA, and so no one has shipped any vaccine anywhere, at least to the best of our knowledge. They're not able to ship that at this point. But if the approval process goes like we think it is with FDA and with the ACIP, we should have vaccine in our state early next week. I'll just say up front that if it's approved by FDA and ACIP, that gives us all the confidence I need to take that vaccine. I'll take it myself. I'll recommend it for my family, and I would recommend it to you all when it's your turn to get the vaccine. We have a lot of confidence in the safety process that they have put in place for that. When we get the initial vaccine, it's expected to be the Pfizer product, and as you know, there's some real exacting cold chain requirements with that. It has to be kept at ultra cold temperatures. It has to be held in minus 80 degrees centigrade freezers, and that means it can't be shipped to everywhere in the state right off the bat. The shipments come in a minimum of 950 doses, almost 1,000 doses, and we want people to use those doses within about 10 days once they get into that pack. And so there are only a handful of places that can store the vaccine at that temperature and help us get out at least 1,000 doses or more in that period of time. And so we have identified about 15 locations in the state that are hospitals that are able to meet those requirements and who are willing to do that. They will be not only vaccinating their own staff, but also others in their community that are in our priority group. I know a lot of those hospitals have spoken publicly about that. We just haven't put out a public list of those names yet, but we'll do that very soon. We just have some logistical and security things we want to clear up first, but we'll announce those names real soon. But they're basically larger hospitals in our larger cities, and they're all over the state, and it's not a real secret about that. Once the hospitals get those vaccines and we have the recommendation from the advisory council, the ACIP, we'll be ready to get shots into arms hopefully that day or the next day. The hospitals will be keeping a portion of those of their allotments for their own staff, but then they are also going to work with us to reach out to others in that top priority group, which I'll discuss in a minute, who are in their community and in their county or in their catchment area. And we can reach the majority of people in our state actually just from these 15 sites alone. The next week, the following week, we expect to have more Pfizer product, and we believe that the Moderna vaccine product will probably start shipping that week as well. The Moderna product is a lot easier to handle in terms of the cold chain requirements. It can go in a regular freezer, refrigerator freezer that you would find in any pharmacy or doctor's office or clinic or community health center. So it will be able to get to a lot more places more easily than the Pfizer product will. The priority groups that we're using in Alabama are those that were identified by the ACIP last Tuesday evening. You may have seen that announcement. But we are prioritizing those frontline healthcare workers and those residents of skilled nursing facilities as the priority 1A population who will be the first to receive the vaccine. We have large numbers of healthcare populations, large number of healthcare workers in Alabama. That's a fairly large population. It's close to 300,000 people. And so within that group, we have to do some prioritization of risk. Those who are really on the front lines and face the most risk will be the first to go. Those are people who work in hospitals. Those are people who work in public health. In some cases, people who work in certain doctors' offices or clinics in some cases. And we've worked very closely with many groups in the state to help us understand their own individual constituencies. So the Hospital Association, the Nursing Home Association, and the Medical Association, some of the other provider groups like the Family Practice and Pediatric Associations. We've worked with pharmacists and nurses groups and others, and they're helping us devise a strategy for identifying those people who need to get the vaccine first. I think the most difficult thing for us to say after waiting all this time is there's just not going to be enough. There's going to be a scarcity of vaccine, and that's going to continue for a while. And we want people to understand that. We fully recognize there are going to be some people at the very tip top of our priority list who are frontline workers and who are deserving, and they're not going to get the vaccine on the first day. It's going to take a little bit of time before we have enough to go around. We expect that we're going to get just under 41,000 doses of the Pfizer product. It's actually 40,950 is what they've told us to expect. Those will all be dose one, number one for someone. Remember, it's a 2-dose series, and so we're not saving half of that for later. We're going to dose almost 41,000 people with that first vaccine, and then we'll have about 3 weeks to receive dose 2 for those people who got their first dose. The Moderna vaccine that we hope is coming the following week, we're not real firm on the numbers, but it'll be somewhere on the order of that size and perhaps a little bit more in terms of numbers of doses. And that vaccine series, has to be given as 2 shots that are 4 weeks apart. So gives us a little bit more flexibility in where we send it. Besides our healthcare workers, the other group in our very top priority group are our nursing home residents. These are elderly people. In most cases, they're medically fragile in most cases, and they have unfortunately sustained about almost a third of all the deaths we've seen so far in Alabama in nursing home populations. That number actually is better than most states in the country. Our nursing homes have done a good job keeping people safe, but still, unfortunately, almost a third of our deaths have come from that group. Because of the federal program that's going to use CVS and Walgreens to get this vaccine to nursing home residents, we're going to start vaccinating nursing home residents at the end of that first week when we get our second shipment, because half of that shipment will come out of the whole entire state's allotment to go to nursing homes. That's the requirement of using the federal program. So we've worked very closely with the Nursing Home Association on this, and they have been very helpful and very cooperative, and we appreciate that very much. So it'll be the doses coming from that second allotment, the second week, when we'll start vaccinating our nursing home population. We would hope that we could get all of our phase 1A groups vaccinated within a few weeks, but that mostly depends on what kind of allotment Alabama gets. I'm sure you've seen national stories about the scarcity of vaccines, so we're still waiting to work that out. We have others in our phase 1A group, like paramedics and EMS, but also other first responders, police and fire, and other people who are essential to maintaining our society, and they will all be part of that 1A group as well, and we'll get vaccinated as soon as we have enough to go around for those folks. It'll be a little bit longer before the average healthy young Alabamian gets the vaccine, unless they're in one of those essential services. So we think that by the spring, there'll be a lot of vaccine out there. We will have covered, hopefully, most of the people in our phase 1 group and have moved on to others. But it's likely to be early summer before we have enough for the average Alabamian to receive their vaccine. By then, we hope to have recruited many different providers and doctors and clinics and other locations like drugstores and pharmacies to administer the vaccine, and we envision that people can go get the vaccine just like they would go get their health care normally from whoever they use as their provider for that. So I will finally mention that we have thought a lot about the fairness and equity of distributing this vaccine. It's really challenging to think about doing that when we identify people just by a single risk category or by what their job description is. That's not always the most equitable way to distribute things. We know in Alabama that Black Alabamians have borne the brunt of morbidity. They're the ones more likely to die than other people, even though Black Alabamians don't get infected more often on average than white Alabamians. And so when we start off trying to immunize, for example, medical providers like doctors who are working in ICUs, we know that Black Alabamians are not, they're underrepresented in that group. And so we want to make sure that we're thinking equitably about that. We've asked all of our groups, like hospitals, to think carefully about what actually constitutes risk. So you can imagine in a hospital setting, we certainly want to get those doctors and nurses, but we also have those people who work in dietary and environmental and who are your clerks and who are essential to running those units and who also have risk because every day they encounter infected patients. And so we want to make sure that we've thought to be very inclusive of all those people who may be at risk, no matter what their actual job title says. So I'll just finish up by saying I appreciate very much what the people of Alabama have done so far. People have sacrificed so much It's been such a difficult year for everybody. I would say everybody knows someone who's been sick from this disease. Most of you know someone who's died from this disease. We still have some tough weeks ahead of us, but I know that we can get through it together if we can hang in a little bit longer. Please remember to stay home if you can, to wear your mask and stay 6 feet away from people if you can't stay home. And hopefully we'll have better news as our vaccine starts rolling into our state. So, thank you very much. Thank you, Governor.
Thank you, Dr. Harris.
Governor, yes, hi. How concerned are you that the state will have trouble distributing vaccines, especially to those rural areas that don't have hospitals?
Well, I'll certainly ask Dr. Harris to elaborate on that, but there's a county health department in every county in Alabama, and certainly it'll be available there as well. Dr. Harris, you want to add anything about getting the vaccine to rural areas?
Yes, ma'am. Thank you for that question. We are using the healthcare facilities that are present in every county in order to do that. So we do have county health departments that will be administering vaccine. We have pharmacies in most communities, or certainly in all counties, that have the ability to give vaccines. Community health centers, which are in rural health centers, which are throughout the state, are also participating in that, as well as any individual doctor's office or other provider that can do that. We'll have a lot more flexibility when the Moderna product gets here. It comes in doses, in box sizes of 100 vials or less, as opposed to almost 1,000 with the Pfizer product, and it doesn't have to be kept at that super cold temperature. So once we have the Moderna product, it'll be much easier to get that out to anywhere in the state, very quickly.
Yes, sir.
What would it take for us to see restrictions on gatherings moving forward? We heard you say that you won't close down any businesses, but if the pandemic continued to grow, would you consider a restriction on public gatherings or tightening those restrictions?
Would I consider restrictions on what?
Tighter restrictions on public gatherings.
No, I don't think so. I have no plans to close Mardi Gras, for example. I'm working to be sure Mayor Stimpson and his city council and county commissioners, et cetera, have all the resources they need. But no, I don't have any plans to limit folks.
Any other questions?
Yes, sir.
A question for Dr. Harris regarding something we discussed last week. The CDC had recommended perhaps shortening the quarantine period from 14 days to 10 days. Is that addressed in this health order or in any public recommendations from the health department?
Yeah, sure. The question is about the quarantine guidance for close contacts from CDC. This is not addressed specifically in the health order, except that the health order continues to say what it said all along, which is there's a quarantine period, set by the state health department. We plan to issue guidance on that probably today or tomorrow. We've been looking at that for the past week. Just briefly, you all may remember that CDC said last week that instead of a 14-day quarantine, even though a 14-day quarantine for close contacts is still preferred, they allow, in some cases, a shorter period depending on the individual situation in different states and what state health departments feel is appropriate to do. Very likely what we're going to do is say that the 10-day quarantine makes sense, but I would encourage you to spend a few minutes and read what CDC actually said. They didn't just reduce it to 10 days, but in fact they said 10 days as long as there are no symptoms at any time, as long as there's not ongoing contact with someone, as long as people continue to do things like wear masks and do sanitation, but also as long as they continue to be monitored. They have to have frequent temperature checks, and they have to keep record of any symptoms and touch base with someone who's monitoring those symptoms. And so it's not as simple as just saying they dropped the number, which I think is how a lot of people think when they see the headline.
We know that the vaccine will be free, but I've been hearing reports that might be possible recipients may have to pay an administrative fee for the vaccine. Could you explain why, and if so, who would fall into that category, and how much could an Alabamian anticipate paying?
Sure. The vaccine is given free to the states by the federal government, and no one is going to be charged by that. As a way of encouraging providers to give the vaccine, the federal government is allowing providers to charge an administration fee for those people that have, insurance to cover that, like, Medicare or private insurance, and those companies have all agreed to do that. However, patients are not going to be charged a copay for that. There should be zero out-of-pocket expenses for any patient. It should be free to the patient as far as the patient sees, even though the doctor might bill the insurance for an administration fee.
We have just finished hearing from Governor Ivey and Dr. Harris. Some of those key points were 40,950 doses of Pfizer were being delivered this round. The second round of vaccines will be sent 3 weeks later for those that received the first dose. Now, Moderna will be sending their doses a week later, and the hope is to get that phase of 1A groups vaccinated within the next couple of weeks. Those phase 1A employees were announced by the ACIP last week, and those people are frontline healthcare workers and nursing homes. It'll be early summer before the average healthy Alabamian gets the vaccine, and there is not going to be enough vaccines at first. It is going to take time to get enough vaccines, and each shipment will have 950 doses of Pfizer. That will be going to 15 locations in Alabama. Some here locally is what we have heard. Now, Black Alabamians have had to deal with the brunt of this virus, so they are trying to be very inclusive of who will be receiving the vaccine. So far, 2,100 COVID-19 inpatients are in the hospital. This is worse than where we were in the summer during the peak when we were struggling the most, says Dr. Harris. Now, the country's numbers, he continued saying, are out of control. Since February, there were 15 million total cases being reported, and now we are reporting more than 1 million cases a week. So you can understand the severity of these numbers and the situation that the country is in. As for the mask mandate, it has been extended until January 22nd at 5 p.m. That is our special report for now. Be sure to tune in to tonight's 5, 6, and 10 o'clock news and keep up with the updates about the pandemic on dothanfirst.com. I'm Ilyana Capellan. Have a nice day.
You've been watching a WDHN News special report. We now return to our regularly scheduled programming.